In 2003, passionate and caring community members formed the Prevent Coalition in Clark County, Washington, in order to address youth substance misuse and create positive change for young people. Following this grassroots movement, Prevent was awarded the Drug-Free Communities Grant in 2007. The coalition went on to create many positive changes, from implementing community projects to mentoring neighboring coalitions and sustaining the work with additional funding.
I always tell everybody we don't drive ambulances. We're preventative.
I know that if we can prevent kids from using when they're kids, they have the chances that they will have problems associated with substances when they're adults are so decreased.
It's really getting at some root cause problems and figuring out where we can connect people and make relationships stronger.
I think the most important thing early on was to get out and talk to people in the community.
I had a son who was impacted by substance abuse, and I wanted to do something to try to make a difference.
To me, the coalition work is about making positive changes in your community, and they're really elegantly simple changes.
And the best way to prevent youth from using substances is to talk to the youth directly, right? And find out what's causing them to use, how to best relate to the youth, and the people that know the youth the best are the youth themselves.
To actually look at the data and then look at evidence-based strategies that will change the data points. And that it's not just, oh, well, let's try this or let's try that or this sounds good, but that we have a strategic plan built around what's effective and what's effective in communities that are like ours.
We were so fortunate to have a really strong group of initial volunteers that started this coalition. And a lot of them had personal experience with substance abuse and youth substance abuse and felt really passionate about addressing this issue. And that passion is essential, is the beating heart of the coalition. It's so important to understand how the different sectors of the community, whether that's law enforcement or schools or public health entities or governmental agencies or the business world, like how they are seeing the problem. Because it's so easy to kind of be, in our lane and to see the issue the way that we see it. And so to get out and talk to people both about how they see the problems, what they see as the most important problems are, what they see as possible solutions, what barriers to those solutions might exist. And then it's also really important to understand what has been tried, because there's always a lot of people who are out in a community doing the work. So it's key for the coalition to understand, what's being done. And that's key, first of all, just for understanding, but also for relationship building.
In general, I do believe that relationships are what make the difference in terms of our partnerships. It also has to be a readiness in the community. Sometimes communities are ready for this prevention work, and sometimes they're just not. And so you have to work to inform and educate them to get them to the place where they are ready for this prevention work. We've had tremendous support from law enforcement, which has made a huge difference in our ability to carry out different things, and it also gives us a tremendous amount of credibility. Getting into the schools is also critical, as that's where children are. So working with our schools has been really important in terms of reaching the students. We also try to reach parents, and we need the help of schools as well to help us reach the parents. So that's some of the examples. We also have support from our fire department, from our city government. So it really makes a difference when we're trying to reach the entire community in all these different aspects.
Drug Take Back program was created in conjunction with Clark County Public Health, and we started accepting back, with the help of our law enforcement partners, accepting back any sort of medications that people wanted to get rid of. And having medications left over in your cabinet is easy access for young people or people who are searching out drugs for abuse rather than for medical use. So our goal was to get out some information about that and provide a safe way for people to destroy their medications that they weren't using anymore. And man, did that get popular. People would really, we started with one site and grew to about 5. Which was always just tons of information that we were giving out, and also a lot we were receiving. And we had lots of volunteers that wanted to be a part of that, and it was a really good publicity for our coalition as well as a good thing to do for the community.
There were several suicide attempts and suicide deaths in the center. We're a tiny town, and the amount was way out of proportion. And Prevent came and talked to us, and the difference that they made was huge, because they told us that we needed to focus on what really needed to be done. All of our initial address was, oh, let's go in and talk to them, and let's give them all hugs, and let's give them pizza parties or whatever. None of this works. And so what they taught us to do, which I love this, is what we were ready to do was ready, shoot, aim, as opposed to ready, aim, shoot.
Prevent Coalition strategy is purposeful. Prevent takes the time to look at research and plan before implementing a program or strategy.
The assumption was kids were using drugs as recreational use because they were bad kids. That's what a lot of community members thought. These are just bad kids making bad decisions. And what we found is that these are kids trying to make good decisions and not having good resources to do so. So they were doing the thing that made them feel better. And using drugs and alcohol made them feel better, but they didn't have the capacity to understand that it was actually hurting them in the long run.
The early hurdles are about understanding how prevention science works, and that we want to make sure that we're using trauma-informed, that we're using things that are effective, and that's not always kind of a big event or something that, like a car crash and those kind of days are gone, that we really want to use the data and look at what's happening in our community and then use effective strategies. So that was a hurdle to kind of get that prevention science.
The Mentee Program provides support to a new coalition coming on board to the program. So I had a Prevent member actually go through the 3-week training academy with me. That way we could brainstorm together and really relate the materials we were learning to our local community. They were a wonderful sounding board as I was trying to navigate in our community and get my program up and running. And they provided leadership amongst the different coalitions.
And really the whole premise and idea behind it is that local problems require local solutions. So whatever's happening in Vancouver is probably a bit different, and the needs are different than, for example, in the center. And really they're not that far apart, but they're different communities. And so that is the reason we have so many coalitions and that we had the Mentee program, because Prevent was able to help smaller communities build their own coalitions, build their own capacity, learn about prevention science, learn what actually works in prevention and what doesn't, and apply for funding and actually get funding that brings those resources into their communities.
Well, the campaign that we were specifically working on at the time was the Weed Can Wait campaign. And Prevent has always been focused on youth, right? So it's youth substance abuse prevention. I thought it was good because it was a clear and simple message, but it was also a unifying message. So it was after marijuana legalization in Washington State, and it wasn't 100% anti-marijuana and that it's like a demonization or anything like that. But it was more like, we just need to protect our youth. And so by the Weed Can Wait, it was saying, even if you want to use, at least delay it until after you're 21 and it's legal to use.
And believe me, there's agencies out there that are doing a ton of marketing and research on youth, and it is pathetic if prevention isn't doing the same. We've got to talk to them. We've got to see what's attractive to them. We've got to stay current with them. I almost said the word hip, and that's probably not hip.
That I had the opportunity to, with 2 other youth, lead the youth advocacy training at in Washougal for all of the youth from our area that were going to be going up and speaking with their legislators. And that was really probably the highlight of the advocacy work that I've done here with the Prevent Coalition, is enabling my peers and other youth to be able to use their voice in order to talk to their legislators.
What's essential with a coalition is that there's that coalition ownership that can continue, beyond any coordinator who will be there, because coordinators will come and go. And so I think it's, speaks to the strength of what we built here and what ESD has supported here.
That lack of ownership, in a way, is the humility in that is why this model has worked so well and why the work continues.
There's 15 coalitions. There was none in Clark County. Prevent was the first. Then there were 3 with Prevent, West Van for Youth, and Unite Washougal. And now, because Prevent works regionally, there's 15.
It's not a one-size-all, we're going to do this across the country approach. It's looking at what's going on in your community and how you can change things so that kids are not using drugs and alcohol.
It's difficult to know exactly what is going to work, and our kids are worth it. And I'm just honored to have been able to be a part of this work, and all of the community members that I've known, and just want to say thank you.